insiders. The legislation very specifically says who is on the commission and who in government appoints those people. For instance, only 2 of the governor's 12 appointees are required to be mental health industry insiders. All 12 of his appointees are, even though only 2 are required to be. So for instance, there's a position for employers of companies that have less than 500 employees and in companies with more than 500 employees. Those commissioners should be people from Chamber of Commerce, downtown business groups, police, small police department, big police department. But instead, he chose an insurance executive for more than 500 and a mental health provider for less than 500. And as I think I've made clear, the mental health industry is not really looking to focus on the seriously ill. Another level of oversight is the counties. And again, I don't know this county, so everything I'm saying maybe isn't true for this county. But planning boards are developing mental health policy. The only people who go to those meetings are insiders who want funds flowing to their programs. And so they're either opining on the Mental Health Services Act plan that the county behavioral health director is developing, or they're actually telling him or her what it should be. The county behavioral health directors look at the mental health industry people who go to these meetings as their constituency. They are not looking at the public as their constituency. They are looking at the mental health insiders who go to the meetings. They're not looking at the mentally ill as their constituency. They are looking at people who go to these meetings. And one of them told me, said, DJ, if I put a new social worker in a school to help the kids get better grades, the PTA is going to throw a dinner in my honor and my picture is going to be in the paper. She said, if I put a new group home for the seriously mentally ill in the community, the PTA is going to run me out of town and they're going to ensure my picture's in the paper as I'm running. So it is very tough for them. They are not hearing from anyone else. I would go to those meetings. I would object every time something is funded that isn't within the correct confines of the Mental Health Services Act. Insist that Laura's Law is in every plan and don't allow them to run a tab for Laura's Law recipients that they don't run for others. Now let me just talk a little bit about the future. Will the insane consequences continue? Will the mental health industry continue to fail the seriously mentally ill? The Affordable Care Act is going to have a lot to do with that. But the biggest missing link is that there is no national or in California state grassroots organization working exclusively to help the seriously mentally ill. NAMI National and NAMI California used to fill those roles, but now they are focused on mental wellness, mental health. I mean, you know, in the mental health industry, we're not even allowed to say mental illness anymore. We have to say behavioral health, mental health conditions, and I cringe in California. I keep hearing we can't have a mental illness center. We have to have a mental wellness center. So there is nobody left advocating for the seriously ill. Maybe some of the NAMI chapters, because the locals do this. The locals are very effective. But at the state level in California and the national level, and by the way, I am running for the board with the national board. I've been on it before with 4 others, and we're running on a focus on serious mental illness ticket. We're going to try to turn NAMI National back to what it should be. Take the debate out of the mental health industry. When there is a high-profile instance of violence, it's going to be reported on the newspaper one day, and there's going to be follow-up for several days. That is an opportunity when the public is interested. Reach out to the media, call. You don't have to be an official. Call the reporter. Usually their email is on the article, and say, hey, I'm the mom of somebody with serious mental illness, and you know, this could have been my son, and here's how it happened. Or if you know more about the system, call and say, you know, this is why this happens. Reach out to your sheriffs, DAs, prosecutors. The event in Hollywood I was at last night was brilliant. They had some, you know, all sorts of criminal justice people because they're running a shadow mental health system for those the mental health system refuses to serve. Somebody testified in front of Congress, a police chief. There are two mental health systems, one that's the traditional one run by the mental health industry for voluntary patients, and all others are offloaded to police and criminal justice. And they want to return those people back. We tend to think of police as the people who shoot the mentally ill. That is simply not true. No police officer wants to pull a gun. And 50% of all line of duty deaths of officers come on mental illness calls. They are our allies. Now, I think our success is going to be defined by how well we take it out of the hands of the mental health industry. And getting back to my sister-in-law, how is she doing? She's doing well. She spent like 10, 15 years in a group home, and now she's ready for independent living. She had gone to independent living right away, but she failed at that. Some people don't need housing first. There are other solutions for people. But there are people like me, and I'm sure others in the room, who have been highlighting the failure of the mental health system to focus on the seriously ill, the shunning of the seriously ill by the mental health industry. And we've kind of been out in the wilderness. And I get a little choked up when I talk about this. It's just I really appreciate that people invited me here and that this argument is starting to gain currency. Carol Williamson, Cheryl Lee, Michael Fitzpatrick, people who've been supporting me, the Brofalskis who provided me a place to stay when I'm here. And I think if we keep at this, and I don't expect everyone to agree with everything I said, but by working together with others who care about the seriously ill, we can replace mission creep with mission control. We can have fewer of our loved ones who become homeless, who become arrested, who become incarcerated, imprisoned in their delusions. And I think that's what we all want. So I thank you for listening.